We're now joined by Dr. Thomas Cavalieri, who is the Dean of the Rowan University School of Osteopathic Medicine. Good to see you, Doctor.
Well, good to see you too, Steve. Thank you for inviting me.
You got it. Doctor, this is part of our ongoing series on vaccine awareness, what people need to know. Question, what is Rowan University's role in this vaccine rollout, if you will?
Well, here at Rowan University School of Osteopathic Medicine, the Stratford campus of Rowan University, we actually have developed the Rowan University Vaccination Center here. So Rowan University is helping to support one of the mega sites at the Rowan College of South Jersey, right, which is pretty much run by the Gloucester County Department of Health. But Rowan University's actual vaccination center is here on our campus. And go ahead.
I'm sorry, Doctor, there's a little delay here. We're taping on the 2nd of February. This will be seen after. Lots of changes having a lot to do with vaccine supply, right? We're actually taping this in the middle of a pretty heavy snowstorm. We're praying that weather gets better, but that's not the only issue. Let me ask you this. From your perspective, Dr. Cavalieri, how much is what you and your colleagues are doing at Rowan based on the vaccine supply?
Well, it's pretty considerable because obviously, Steve, you can't vaccinate people without the supply. So here on Rowan University's vaccination center, we're considered a large site. So in the eyes of the Department of Health, whom we've been working with closely, Commissioner Persicelli. And essentially, as a large site, we administer between 400 and 500 vaccinations per day, Monday through Friday. And I will tell you, our experience thus far we have not had a problem with supply. Now, I know nationally that's an issue. I know some other sites have had a difficulty, but we've been fortunate that we've been able to get the supply we need to meet the needs of the community we're serving, giving somewhere between 400 and 600 vaccinations per day.
So, Dr. Cavalieri, in the spirit of awareness, if you will, particularly for those who are confused, concerned, they don't know exactly what the facts are. Your expertise is in the area of geriatrics, right? Geriatric medicine. My mom, who's watching, I know right now, never going to say my mom's age, but like a lot of others, wanted to, and she was fortunate enough to get the vaccine. Question: is there any issue for older people, say 75 plus, with the vaccine, or does it depend upon underlying conditions?
It's really both. As one ages, our immune system isn't as good as it used to be. This is well known. So as people age, their susceptibility to various infections increases. So age alone is an independent risk factor to develop COVID-19. Also, chronic conditions are of any age. So even if you're younger and you have diabetes, heart failure, kidney failure, those types of things, you're at higher risk.
And so let me ask you this, Doctor. Hold on for a second, Doctor. So sure. This was confusing to me. I have high blood pressure, but being managed. Is that by itself a potential issue?
I would say,
because I'm not alone. I'm not talking about myself. It's millions of people who have some degree of high blood pressure.
Right. I would say high blood pressure managed in and of itself is probably not put someone at a higher risk, but certainly diabetes, heart failure would, chronic kidney disease would. So there are certain chronic states that put someone at higher risk. So Steve, getting back to your other question with regard to the elderly, when you think of it this way, elderly people have increased risk simply because they're aging, but also we know that chronic diseases like the ones I mentioned, cancer, diabetes, heart disease, et cetera, they increase. as people age as well. So it's a double effect. And that's why, for example, 8 out of 10 of the deaths that occur from COVID-19 occur in people over 65. It's really the composite effect of aging and chronic disease that come together to put the elderly at such high risk.
Real quick, and by the way, Rowan University, let me disclose as one of our higher ed partners supporting our healthcare and educational programming. Let me ask you this. Students at Rowan are actively involved, medical students. Talk about that. Got about 30 seconds on that, please, Doctor.
Yes, our medical students here at Rowan SOM are actively engaged in our vaccination center. In fact, I will virtually tell you their involvement in this center is critical to the center's success. And these students are caring, they're compassionate, they really want to make a difference. We call our program here Operation Save Lives. And I tell the students, every shot they give in an arm, they potentially saved a life. So they are so enthusiastic about this.
Doctor, before we wrap up, I need to ask you this. Again, taping on February 2nd, you'll see that. We always disclose when we're taping, it'll be seen after. And we don't know exactly how this plays out, but with the variants, to what degree do these multiple variants, more and more being identified in the United States, in New Jersey, and the country, to what degree does that concern you as it relates to what 1 or 2 shots, depending upon the vaccine you get, that it will cover it? Or is there a booster involved in your view?
You know, it's difficult to say for sure. It does concern me. These variants do seem to be able to transmit from one to another. That is of concerning. So far, we have every indication that our existing vaccines will be effective. However, there is that uncertainty whether that will continue. So it does concern me. At least for now, we're good, but there's concern about the future.
Important information. And by the way, we refer people to the state website, to the CDC website to get more information, because as these programs repeat, you will see that information up there, because things are changing quickly, not just by the week or the day, but by the hour and the minute. Dr. Thomas Cavalieri, Dean of the Rowan University School of Osteopathic Medicine, we thank you very much. And to the students down there and everyone involved in this initiative, thank you for everything you're doing every day. Thank you, Doctor.
And thank you for having me, and thanks for the good work you're doing to get this information out to the community. That's essential. Thank you.
We're all in this together. Thank you, Doctor. I'm Steve Adubato. Thank you so much for watching, and we'll see you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, University Hospital, New Jersey Sharing Network, the Healthcare Foundation of New Jersey, the Robert Wood Johnson Foundation, NJM Insurance Group, the North Ward Center, MD Advantage Insurance Company, and by Suez North America. Promotional support provided by Meadowlands Chamber and by New Jersey Monthly.
I'm Miles, and this is what I work for. To be my best for them and for me, in body and in mind. I need a health insurer that helps me get the care I need for both. That has mental health professionals that I can talk to when I need to. Because when I feel strong and secure, so do they. This is my life. And this is how Horizon Blue Cross Blue Shield of New Jersey works for me.